Oh, hi there. I wanted to make a third installment of LPR or silent reflux or GERD or whatever you want to call it. Basically, a sore throat caused by varying factors. Uh, I drank alcohol for a good solid 10 years and I developed a sore throat about 3 years ago. Uh, there's the regular things that you should do to limit the sore throat or prevent it from happening altogether, and that's only moderate drinking, try not to smoke at all, don't chew tobacco, um, you know, try not to eat fatty foods because that creates a lot of stomach acid. Drink plenty of water, keep your throat hydrated. Everyone should have a wedge pillow because it's beneficial. It's not even that uncomfortable. They're quite good actually. You should just have one. Anyway, I got a sore throat partially because of alcohol use, but I'm beginning to suspect it has something to do with the antipsychotic medication I was on as well. I was on Clopixel, and I've been on a Clopixel for about 4 years. And then the thought dawned on me that I don't actually know what Clopixel is. I have every reason to believe it's exacerbated and, if nothing else, done nothing to stop this sore throat. All my doctors keep saying is it's the alcohol, it's the alcohol. Well, it's not because I haven't drank much in 6 months and it hasn't gone away. My GP had prescribed me Tecta, pantoprazole. I had made a video about taking rabiprazole, which I thought could be poisonous. And I wouldn't, it's not that far fetched to actually believe that. Anyway, my GP would just, all she would say is, keep taking the Tecta, keep taking the Tecta. And that's all she would say. Sure, it limited the stomach acid in my digestive system, which would make things worse if it ever did splash up. And maybe it was helping repair the stomach lining. I have no idea. But the fact of the matter was, it did absolutely nothing for the sore throat. Uh, if anything, it made it worse because part of medicine is psychological, as I've explained in other videos. And the thing is, if I think my sore throat is in immediate danger, then one could argue that it is beneficial because then I'll stop drinking and then they'll just lower or taper off the medicine that exacerbates a sore throat. And that could very well be the antipsychotic I was on because my sore throat came about not too long after I started taking the Clopixel. So in that sense, it very well could be just the medicine. Because I know other alcoholics who are my age and do not have the same problem I have. The difference between me and them is that I'm on an antipsychotic. You don't know what they put in that stuff. They don't have to tell you, and they don't. They don't tell you about their modus operandi. They don't tell you how they treat their patients. Your involvement is very minimal. Uh, any other professional will take the doctor's word over yours any day. And they have protocols they have to go through. They're educated and all that, but it doesn't mean they're right. They quite often make mistakes, and they should be held accountable. Their treatment plan was not working for me. They don't want to accept that. And that's too bad for them. I'll think of a way of getting back at them, I swear. I don't have to put up with this anymore. In fact, I don't even have to take the antipsychotic anymore because I'm on what they call voluntary status, which means I can opt not to take it. But I didn't like the dirty look that my case manager was giving me. Uh, they looked like they were going to cook up an excuse to have me thrown back in there anyway. Uh, the thing is, there would be withdrawal symptoms of being off the antipsychotic. I've been on it for a number of years, and just like any other drug, there are withdrawal symptoms. That's not just psychological, although that would be part of it. It's also physical. Like my sore throat would get a whole lot worse for the short term. Who knows? That could be a few months. And if I weren't taking the medicine, my employer can write another nasty note that they want signed. And in order to get my doctor to sign it, I'd have to be taking the medicine again. So you can understand that this is a vicious cycle. Uh, like, how am I supposed to win? How am I supposed to feel better and actually progress? It's like they want me to collapse. And anytime I phone the nurse's line, the pharmacy line, or I speak to a medical professional, they always say, "Oh, are you having chest pain? Are you having difficulty breathing? Blah, 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 blah." And I go, "Are they asking everyone this? Or are they asking me this because I've described what's going on in my life? And this is what's going to happen in the end is that I'm just going to collapse. That there is no way out of this unless I collapse and I end up in hospital for a few months." Well, that sounds like a shitty answer to me. I don't have to like them, okay? I don't. I don't respect how they do things. I don't like their underhanded, dirty nature. And I don't like how they can pull the high hand as well. It's like they got the worst of both worlds at their disposal. I think my sore throat is brought on upon by the medicine. So I've already taken the initiative and stopped taking the Tecta. And I recommend anybody else do the same thing. And if your doctors won't give you answers like they did with me, they won't explain anything and they just say, keep taking it, then they're up to something. They're lying to you. They're hiding information from you. And that, to me, is unacceptable. That is why I'm renouncing my GP's, my involvement with my regular GP. I know a lot of people wouldn't do that in this society where there's a hard time getting another doctor. I can get another doctor. But I am renouncing uh, the doctor I have right now, who's on sick leave anyway. I've had enough of her. Yeah, it's overall frustrating. I've had this sore throat 3 years. I've gone into ER to hopefully get some explanation about it. Even some frickin' pink lady would be good. Basically, all that is an antiseptic that numbs your throat, and that's about all it does. And it's like Pepto-Bismol, really. They wouldn't even give me that the last time I went in there. Wouldn't explain anything. They just said, "Don't drink, don't drink, don't drink." Well, guess what? That's not a good enough answer anymore. Because I don't think that's the problem. Because I have stopped drinking for a number of weeks at a time. And I've drinking very little in the last 6 months. And it has not gone away. And this lax, I don't care attitude that they've got is not good enough. I don't respect how they go about doing their things. And I'm going to tell people, don't take the Tecta. Don't take any Prazoles. They're not going to help you with your sore throat. Now, other people are going to have sore throats for different reasons. Maybe they're not on antipsychotics. Maybe they are. Maybe they drink. Maybe they smoke. Whatever. But if you drink and you're on an antipsychotic and you're offered a Prozole, um, don't take it. It's not going to help you with your sore throat. Uh, I would recommend that to anyone. I mean, obviously, like I said, drink plenty of water, don't eat spicy foods, and use a wedge pillow. But these are just small steps. They're better than doing nothing, but they're not entirely going to fix the situation. You have to understand the problem and understand it from a pharmacist's position, a doctor's position. They don't care if you're in superficial pain. As long as it's not life-threatening, they don't care. So you can be in it for 10, 15, 20 years and they will not care. If you quit drinking and they just limit the factors that's in their medicine that causes sore throat, in a sense, it's a cure. But it's not really. Because it was their medicine that caused it in the first place. And they will deny it. They'll get obsessive compulsive about it. And they have their ways of changing the subject, moving you along, and pushing you out of the way and just ending the conversation, and there's no way of getting any answers out of them. But guess what? They're going to listen to me, and if they don't, they're going to regret it because I got one of these in here, and I know ways to fuck them up. Anyway, that was my spiel. Don't take any Prazoles, especially Tecta, Pantoprazole. They're not going to help you, and it doesn't matter what your doctor says. They're just a peddler for big pharma anyway. So, take my advice. Go see your doctor, see what they have to say. If they're on the level, that's fine. If they offer you a medicine and they don't describe you anything about it to you, don't make any explanations, then tell them to kindly fuck off because they're peddling for big pharma. And I've made videos denouncing big pharma. Anyway, talk to you guys later. Have a good one.